I'd like to start by acknowledging the traditional owners on the lands on which we're meeting today, and I pay my respects to past, present, and emerging, and to any Aboriginal or Torres Strait Islander people who are with us today. I'd like to extend a warm welcome to Dale Ishkia from Moving Beyond Cancer. Dale is an accredited exercise physiologist with over 25 years of clinical experience, specialising in oncology for the past 11 years. She's the founder of Moving Beyond Cancer, a highly regarded exercise physiology program that is dedicated to improving the lives of people with a cancer diagnosis through appropriately prescribed exercise. Since acquiring her cancer expertise, her qualification is from the American College of Sports Medicine, and Dale has lent her expertise to numerous private clients, organisations and support groups, including the Olivia Newton-John Cancer Centre, the Alfred, Peter MacCallum, the Cancer Council, Think Pink, Pancare, Prostate Cancer Support Groups, and the Ovarian Cancer Australia, and the Leukaemia Foundation. Dale stays up to date with the latest research finding and applies them to her clinical practice to provide the best possible education and exercise prescription to her clients and everyone at Moving Beyond Cancer. Her ultimate professional goal is to reduce the side effects of cancer treatment and to help gain a sense of control over their bodies, while also providing a positive focus. If anyone has questions for Dale today, please feel free to put them in the chats throughout the presentation, and Dale will do her best to answer. She can't give any personal advice, so let's keep it fairly broad. Over to you, Dale. Thank you.
Thanks so much, Alison, for that introduction, and thank you for having me here today. I'm just going to share my screen. Oh, what's happening? Sorry. All right. So I just wanted to talk about the different side effects that can happen when you have an upper GI cancer diagnosis and going through all the treatment. So one of the most common side effects is fatigue. It's the thing that, affects people the most greatly, but also exercise has been proven to be the best counteraction to cancer-related fatigue. And I'm going to cover a little bit more about fatigue because a lot of your questions also were around fatigue and exertion and how hard to push yourselves and things. Cramps is another common side effect. And the best treatment for cramps, making sure you're hydrated, making sure all your electrolytes are replenished, especially if you're suffering with diarrhea and vomiting throughout treatment. And also stretching is the best treatment for cramps. So commonly they occur in your calves or back of your legs and hamstrings. So doing calf stretches, hamstring stretches, that sort of thing is very beneficial. Peripheral neuropathy, so numbness, tingling in your hands and feet is a very common side effect, and that we can certainly help with balance through exercise. We might not necessarily reduce the numbness and tingling, but we can help stimulate the nervous system to slow it down a little bit, but it's very hard to reverse it or change its trajectory. With peripheral neuropathy, it's only can be changed by changing your chemotherapy drugs, so you need to talk to your oncologist with that. Diabetes is a common side effect of treatment, and of course exercise can help manage diabetes. Having a weakened core structure from surgery certainly is a massive side effect, and of course something that exercise can help with. Potential heart problems is also a side effect of chemotherapy, and exercise is shown to have a protective effect of these side effects. There is a rapid deconditioning process that occurs of all systems of your body through treatment, especially thanks to surgery and chemotherapy. So, of course, I'm sure you've all experienced this. It's like a rapid aging process through treatment. So exercise can help counteract that. And increased risk of infection or weakened immune system is another common side effect. So just touching a little bit more on this deconditioning process. So not only the cancer itself, needing bed rest, lack of physical activity, chemotherapy treatment, the normal aging process, immunotherapy agents can all contribute to deconditioning of your cardiovascular system, so heart and lungs, muscular system, and neuro, so your nervous system as well can all be affected, but exercise can counteract that deconditioning effect. And it's now recommended, because the evidence is so strong around the benefits of exercise throughout cancer treatment, it's now recommended as part of everybody's cancer treatment. So the Clinical Oncology Society of Australia now recommends that exercise be a part of everyone's cancer treatment, as does the American College of Sports Medicine. So it's actually very, very beneficial and important. But of course, you may not be able to do exactly what you could do before, and you may be feeling really sluggish and wanting to know exactly how hard you can push yourself, which I understand you guys have asked that question. So I just wanted to touch more on cancer-related fatigue as well. So it's the most limiting factor to quality of life. People feel that they are really struggling with fatigue. They're not able to enjoy what they used to enjoy. It's super common, 40 to 80% of people undergoing active treatment. It has the following characteristics, like weakness, heaviness, difficulty concentrating, low motivation, trouble sleeping. And it usually reduces 1 year post-treatment. And for some people, it does continue on in the last for 5 years. There's other contributing factors to cancer-related fatigue. Not only the cancer itself, but actually feeling depressed can contribute to fatigue, that deconditioning process that I talked about. So the less fit you are, the more fatigued you can feel. The cancer treatment itself also contributes to fatigue. Anxiety and stress can contribute, poor sleep, anemia, so when your red blood cells are low, any other medication you might be on, poor nutrition, hypothyroidism, and inflammation. Those things that I've changed the colour of in the orangey colour are things that exercise can help with. So exercise can help with depression, anxiety, stress, of course, deconditioning. So we can work on reconditioning the muscles and the cardiovascular system and the neuromuscular system through exercise. Exercise can also help with improving sleep, and it also helps with improving inflammation. So we can definitely improve cancer-related fatigue through exercise. But things like poor nutrition is something it's really important to address, to make sure you've got the right nutrients in your body before exercise. And also another factor is rest is equally as important as exercise in terms of improving your fitness level and recovering from exercise sessions. There's no point going out and slogging yourself every day if you're just not recovering from those exercise sessions. So I recommend that everybody actually has a lie down, a little nana nap or a siesta at about 1 or 2 o'clock every afternoon to try and allow your body to recover from the effort you put it through. So I just wanted to touch on this immune function theory, that exercise can improve immune function, which is more recent evidence, because we used to be all about how exercise can counteract the side effects of treatment, but it can also, there's a lot more evidence around the fact that exercise can actually not only improve chemotherapy, the efficacy of chemotherapy, so how effective chemotherapy is, because it helps deliver the chemotherapy agent around the body, but also exercise can improve your immune function. So dosage is important in terms of exercise. So the best dosage is regular moderate exercise training. So we have found that acute, intense, prolonged bouts of exercise actually can decrease your immune function. So it's about hitting the sweet spot of exercise intensity. So not going too hard for too long. You actually want to find your moderate zone, which I'm going to talk about in a minute. So this is, again, this is my flyer we put together a while ago, talking about the different ways exercise can improve or exercise can help during cancer treatment. So not only counteracting all the side effects like fatigue and chemo brain and aerobic capacity, but again, efficacy, improving efficacy of treatment and immune function. And it actually has been shown to improve survival, chance of survival. So the dosage, the bare minimum dosage of exercise for everybody going through cancer treatment is doing cardiovascular exercise, a minimum of 30 minutes a day, 5 days per week, and resistance exercise training, so weight training, 30 minutes a day, 2 days per week. But the dosage is not only the frequency and duration, but also the intensity, which I'll talk about. So I'm just going to flick forward. So yeah, the intensity is where you want to work at for moderate intensity. So moderate intensity is around 12 to 14 on the Borg scale of perceived exertion. So the perceived rate of exertion scale goes from 6 to 20. So 6 is lying down on the couch, resting like that kitten, rancho relaxo, doing nothing. And 20 is pushing yourself so hard you're going to pass out. So moderate intensity is between 12 and 14, so somewhat hard. And then vigorous intensity you can move into between 14 and 16. And the idea of these odd numbers is you pop a 0 on the end of it, and it's about where your heart rate should be. But when you're going through treatment, your heart rate is typically elevated by around 10 beats per minute, both at rest and during exercise, which is why we use this perception of effort scale as a more accurate scale. So, of course, throughout chemotherapy, for example, depending upon your regime or your how it's administered, but it might be every 3 weeks, for example, you might get chemotherapy. So this is going to vary throughout the chemotherapy cycle. So on the day immediately, or like 5 days post chemotherapy, is typically everybody's lowest point in terms of fatigue level. And you just find that walking for 5 minutes you might find somewhat hard during that day 5. Whereas on day 20, when you're about to go back into chemo, you're actually at your fully functioning self. Somewhat hard might mean a 5-kilometre run for you, or a 5-kilometre walk, for example, or walking up hills and things like that. So it certainly does depend, and that's why we like using this perception of effort scale. There are certainly ways we look at heart rate and using heart rate reserve, which calculates uses your resting heart rate to calculate where exactly your heart rate should sit. And I can show you that if you're interested in that calculation. But it's really important that exercise is tailored to you. So how long ago was your surgery, for example? Of course, there's a 6-week recovery period post-surgery. Do you have any cardiac issues or joint problems? How has your treatment affected you? Are you suffering with peripheral neuropathy, fatigue, balance issues, anemia, neutropenia, which is low white blood cells? Are you in pain? What are your goals? What do you enjoy? What's your previous fitness levels? Because, you know, someone's asking there about cycling and someone else might be asking about putting out the washing on the line. So it's very much needs to be targeted according to where you're at. But it's important that an exercise program not only incorporates cardiovascular or aerobic exercise, which is like walking, cycling, swimming, those sorts of things, but it's really essential to include strength training to ensure that your muscular system is stimulated and you're counteracting that muscle loss that occurs with the deconditioning process. It's important that it incorporates core or abdominal exercises to counteract any surgical procedures. It's important that it incorporates balance exercise because chemotherapy can affect your balance, and also flexibility exercises to make sure you don't get any joint pain. So before starting an exercise program, I mentioned this before, it's important to have the nutrients to fuel your exercise. Are your blood levels within a safe range? So there I'm talking mainly about red blood cells. So if you're anemic, that is not ideal. It's when you're anemic, it's just very hard to push through exercise. So you shouldn't push through if you're anemic, you should rest. If your platelets are really low, you shouldn't be doing any impact exercise. And if your neutrophils are really low, you shouldn't be exercising in a swimming pool, for example, or in a public gym. So you may have lost fitness and strength, so you need to go easy, and better yet, get assessed by an accredited exercise physiologist like myself, so we can target your exercise program according to where you're sitting right now in terms of strength, resistance program and cardiovascular. You need to ensure that you've recovered from your surgery, so get clearance from your surgeon that you are good to go in terms of strength training. If you've got a port, making sure that's all okay and recovered, and if you've got cramps, to manage those properly. I love the fact that I'm seeing Brett put his runners on right now. I've motivated him so much. He's about to run out the door. This is great. Thanks, Brett. Sorry.
Yeah, not runners. They're just my shoes. That's all right.
Okay.
But I have had a run this morning, though. Yeah.
Oh, good.
Yeah.
Excellent. Sorry, I'm really struggling to talk right now, and I'm getting dizzy from shortness of breath. So I'm just going to take a few breaths. So when you have gone through your surgery, it's really important to move as soon as possible. And the idea of that is to get your foot pumping as soon as possible and getting short walks. And the idea of that is to reduce blood clots. So going to the toilet often is really important. Should have a lifting limit of 2 kilos for at least 6 weeks, but remembering that is only for 6 weeks. Often people think that limit is forever. It is only for 6 weeks post-surgery, and then you should be clear to slowly progress the amount you can lift after that. It's also really important to breathe throughout exercise, so no breath holding, which is what I'm struggling with right now, talking so much, so you don't get dizzy. Focusing on your legs initially, and then gradually introducing abdominal training and abdominal exercises, and gradually increase that load, especially with resistance exercise, but also with your walking tolerance or bike riding tolerance, just progressing slowly. A good rule of thumb is about 20% every 2 to 3 weeks. But that can, of course, be increased if you are, feeling like you're flying and you're recovering really well. And it's all about how well you are recovering from your exercise sessions as to how quickly we progress those strength and also cardiovascular. Oh my God, it's already 11:30. So exercise during chemotherapy is safe and it is recommended to keep active. You should exercise to tolerance, so according to how you're feeling, which is why we refer back to that Borg scale of perceived exertion. You should expect fluctuations in your energy. And again, be guided by your own perception. If you've got a port or a PICC line, there's really no issues around exercising with a port or a PICC line. And just watch out for balance. If you're feeling dizzy, make sure you're not putting yourself in danger in terms of exercise and dizziness. So avoid things where you're getting up and down off the floor a lot. So just touching more on the fluctuations, your exercise tolerance will vary from day to day. So you're going to have good days, bad days, and just forget about it days. And doing something is better than nothing. So we often prescribe people with a no-way day program, which might just involve doing gentle stretches lying down, but it's just good to keep in that routine of moving your body in any way possible. And as I said before, rest and recovery is just as important as the exercise itself. So actually lying down every afternoon. And if you feel like you've worked out quite hard the day before, have a much easier exercise session the following day. So beginning as soon as possible. You can begin throughout treatment, even before treatment, but that usually isn't possible with pancreatic cancer because you usually started very quickly. Start low, progress slow. Increasing your duration first, trying to build up to that 30 minutes, 5 days a week. Increasing the frequency, trying to build up to the 30 minutes, then increasing to 5 days a week, then you increase your intensity. Things like fatigue management, sorry, I'm whizzing through this because I've got a class starting at 11:30. Other things to address fatigue is things like meditation, relaxation, establishing realistic goals, pacing, exercising at the time of day you're least fatigued. For most people, that is around mid-morning. Doing something consistent and sustainable. Don't do massive things that cause you to crash completely. Using a diary to record your response and your fatigue response and energy levels. Making sure you're eating nutritious food, getting into a regular sleep habit, and exercising outside is a great way to deal with fatigue as well. This is when you should pause exercise. If you're getting dizzy or faint with exercise, if you're getting any cardiovascular symptoms like shortness of breath, low blood counts, fever, an active infection, high temperature, severe diarrhea and vomiting. So you can find an exercise physiologist near you. Going through the ESSA website. We are more than happy to see people online at Moving Beyond Cancer if you're too far to see us in person. But if you need someone closer to you, you go to the ESSA website, .org.au, and find an AEP near you. So exercise will help you live longer and stronger, and it's one thing that you can do for yourself, which is great.